Assalamu alaikum, the communication day. We are starting with this scenario. You are the medical doctor in the intensive care unit. Please read this summary and continue with the consultation. Mr. Alfred Swallow, aged 80 years. Mr. Swallow has been in the intensive care unit for the last 2 weeks, being treated for cardiorespiratory and renal failure after an emergency aortic aneurysm repair. Despite all active treatment, he hasn't improved, and the surgical and ICU teams have decided to withdraw treatment. This has been agreed with the ICU sister as well. The consultant feels this should begin by tailing down the inotropic support first. This, in the opinion of the consultant, will probably lead to death within an hour, as Mr. Swallow has been dependent on high dose of inotropes for a while. Mr. Swallow is well sedated with opioid and benzodiazepine and shows no signs of distress, pain, or discomfort. The ICU sister has just told you that the daughter, Mrs. Wild, is waiting in the relatives' room to be briefed on the decision. Your tasks are to break the bad news regarding Mr. Swallow's condition, explain that the ICU team feel that withdrawing treatment is in the best interest of the patient, and explain how this will be done. Okay, if you're ready, we can start after sharing the timer.
Okay, Dr. Wes.
Okay, here you go.
Hello, good afternoon.
Hello?
Hello, good afternoon.
Yes.
I am Dr.
Yes, good evening.
Okay, good evening. I am Dr. Mandoor, the critical care unit doctor. May I confirm that you are Mrs. Wild?
Yeah, doctor, I am the one.
Okay, nice to meet you, Mrs. Wild.
I'm not nice to meet you, doctor.
Okay, I'm sorry for that. So I want to confirm that you are the daughter of Mr. Alfred Swallow.
Yes, I am.
Okay, you are the next of kin to him.
Yeah, doctor.
Okay, can you confirm the father age, please?
Yeah, he's 80, doctor. 80
Oh,
years.
okay. Okay, we are here today to discuss the issues, the health issues related to your father. Is that all right for you?
Yeah, doctor. Actually, I'm the one requested that.
Okay, Mrs. Wild, can you tell me how much do you know about your father's condition?
Yeah, doctor. My father had what's called a heart problem, and he had his heart was stopped, and I think they did for him some heart massage, and they connected to some tubes and machines, and I don't know what's going now, doctor. I am so concerning about his condition. Please
Okay,
reassure me, doctor.
okay, Mrs. Wild, I'm so sorry for your worry, and I'm so sorry for what's your father gone through. And before I answer your concerns, do you have any expectations to his case?
Yeah, doctor, I expect that you'll support my father till the last moment of his life.
Okay, I appreciate that, Mrs. Wild, and I'm so sorry for your father suffering. And first of all, I want to tell you that I have bad news for you today.
Oh, doctor, worse than what I told you. I told you the worst news ever. Now you are telling me you will give me another bad news. What do you want to tell me, doctor?
Okay, I'm so sorry for that, Mrs. Wild. Your father is in very critical case, and he is not, and he is in the maybe he is the end of his life.
What? What you are talking about, doctor? You are not supporting him? You told me earlier, and this is what I know from the team here, that you are going to support him till the end of his life.
Okay, I appreciate your concern, Mrs. Wild, and I'm so sorry for what you feel. Be sure, Mrs. Wild, that he is under the full care and support, and he is under all medications and the machines that keeping him alive, and he is comfort now by the medications. But I'm so sorry to tell you that he is in a critical situation now because he has multiple organ failure, as you told me already, his heart, lung, and kidneys in failure already. So I'm so sorry to tell you that he is seriously ill, and I'm so sorry for what you feel now.
Yeah, doctor, I feel so frustrated, doctor. What you want me to know, doctor? What you want to tell me? Tell me, doctor. Be honest,
Oh,
please.
okay, Mrs. Wild, I appreciate your concern. Before that, can I ask you a question, please?
Yeah, sure.
Okay, Mr. Swallow, he had any living will?
Um, I'm not sure, doctor, but I can't tell yeah, he doesn't like the hospitals, doctor, and always he's expressing that he want to die in his bed at his home.
Okay, Mrs. Wild, I appreciate that, and I will explain you more about his case, his condition. Now, as you mentioned to me, he had heart stopped before, and this can happen again. And instead of making a massage and harming him, and also maybe we will make fracture to his chest wall because of this massaging, and the possibility of coming back is very low, especially his brain is affected as well. I'm sorry to tell you that if his heart stops, we can leave him to pass away in a peaceful way without harming him. So, what do you think about that?
Oh my God, no, doctor. Oh my God, I didn't expect that, doctor.
I can only imagine how you feel now, Mrs. Wild. I'm so sorry for your worry and your suffering because of your father.
Doctor, will he die, doctor, if you do so?
I appreciate your concern, Mrs. Wild. As we mentioned, if his heart stops, he is going to die, yes, he's going to pass away. And we need to keep him to pass away in a peaceful way, keeping his dignity without making any harm to his chest or to his other organs. And as I mentioned to you before, that his the possibility to regain his life is very low if his heart stop.
Doctor, I have another question, doctor.
Okay.
Will my mom come to see this, doctor, please? I don't want you to leave my father die before my mom will come here.
Okay, I appreciate that, Mrs. Wild. Yes, of course, you can bring your mother to see him before anything like that happen, and we will keep him under the machines until your mom come to see him. And be sure that we are going to support you and support your mother about this condition. Okay?
Yeah, doctor, please. Another question, doctor.
Okay.
Will you remove these machines?
Okay, I appreciate your concern, Mrs. Wild. I want to explain you more about what is the situation of these machines and the medications he is given. This machine is keeping him alive, and the medications that we call inotropes, this means these medications that make the heart pumps and maintain his blood pressure. Without these medications and these machines, I'm so sorry to tell you that he is going to pass away and his heart will stop. So if you want to listen to our plan according to the medical team decision and in best of the interest of him, we are going to grade these medications down until he pass away peacefully. And as we mentioned, as you requested, we are going to keep him under the full support until you bring your mother to see him. Okay?
Yeah, doc. So what I understood now, you will leave him connected to the machine, and until my mom will come, then you can remove the machine, isn't?
Yes, Mrs. Wild, as we mentioned,
Two minutes left.
we will keep him under the full support and care until your mother see him. And then, as we mentioned, we are going to grade down the medications, keeping his heart beating. Okay?
Okay, doctor.
Okay, I'm so sorry, Mrs. Wild, for your situation, and I'm so sorry for your father suffering. And be sure that we are going to help you, and to be around you, to give you the full care and support. If you need any help at home,
Okay, doctor. Thank you so much.
okay. Do you have any concerns so far?
Um, no, doctor.
Okay, Mrs. Wild, I'm going to summarize. As we mentioned before, that your father, Mr. Swallow, has multiple organ failure, heart, lung, and kidneys, and he is kept under some medications and machines that keeping his heart and his blood pressure maintained. And as we mentioned, to let him pass smoothly, we are going to grade these medications down. Okay?
Okay, doctor.
Any
I heard
concern?
this bad news before. No, doctor. Thank you.
Okay, I'm so sorry, Mrs. Wild, about that, and I'll give you some brochures about the end life brochures and websites to read more about that. And please don't hesitate to ask us or call us for any help. Okay?
Okay, doctor.
Any other concern?
Mm, no, doctor.
Okay, thank you, Mrs. Wild, and please accept our condolences.
Okay, doctor. Thank you.
Okay, thank you.
Your time's up, and let's start the comment. Yes, well done, Dr. Ahmed. You did the most of the task, the steps of breaking bad news as you did. Uh, let's start from the beginning because you said nice to meet you, and she's never will be nice to meet you because
Yes, I'm
she's
sorry for that.
yeah
Yes.
yeah. So don't mention it in the whole exam, even when in the clinical case, a long clinical case. I mean. Just, I'm here to address your concern. Can we talk about your health or whatever you want? But don't say nice to meet you. I hear most of them saying that, but I didn't feel it's good to say it,
Yes,
right?
yes.
Yeah. The confirmation, the introduction, I'm here, and what do you know about your father condition and the expectation, all this went good. But don't repeat what she mentioned to you. Yes, I mentioned that my father heart and lung stopped and they did heart massage. If you want to start from what I stopped in. So if you want to say yes, your father heart now is being supported by some medication which help his heart to pump, along with another medication to support the to blood pressure to raise it up. And beside that, we connected him through a tubes or through tubes to a machine called ventilator. This machine, yeah, support his breathing. As long as he's on these things, his heart will pump. However, whenever we stopped it, he will die. But no need to say pass away, okay? Just die. Be honest or be clear with this word. Your father might die if we stop this medication or stop this support. And this is the medical decision along with the other group of doctor. This is the best interest for his condition. Along, of course, with the kidney failure, which is stopped, and he might need also support for the kidney. Okay, so no need to repeat something she mentioned to you. This is the in summary what's my advice. Okay, the breaking bad news way you started good. You say it well. You said that you have bad news, and it was like a warning shot. Then you make a pause. Then you give me the bad news, which is your father will die, or whatever you want to say. But if you want, as I said, don't start or repeat what I said. Okay, they are commenting on this. Let's go to the concern one by one. There are three concerns for this scenario. Will he die if you remove the machine? What's your answer, Dr. Ahmed?
Will he die?
Yeah, will he die if you remove the machine or we remove the machine?
Okay,
And
I will
how,
appreciate
for how long?
this.
Yes,
I will say, I'm sorry to tell you that yes, he will die if we remove the machines.
yes, yes. This is the answer. Be clear and try to make more sympathy in this question, because
Yes,
this is the most concerning question in the scenario.
yes, I have to
Let's,
say I am sorry,
yeah, I'm
like this.
sorry, and the tone
Mm,
also. Make the tone lower little bit,
yes.
and yeah, be sorry, and I'm afraid to say, or I'm sorry, and I'm afraid to say, yes, he might die because his condition is getting worse and worse. Although we did the maximum support for him and for his condition. And be sure that we are here to support you as you did, and to support your family, and to be with him, and to keep his dignity, not to harm him more as you did exactly, but try to make it little organized, okay? And in order not to break his bones, not chest wall, because chest wall, she doesn't understand what's the chest wall. So you can say to break his bones, okay? And the machine inside, the tubes inside his mouth, all the things harm him more than he deserve. And your father already suffered a lot because of the what happened now and what happened before. Okay, this is for the when he'll die, or when you will remove the machine, or when he will die. By the way, this scenario is under the term of end of life care or withdrawal of treatment. In the rider, it was written in withdrawal of treatment. Okay, but it's equal to end of life care, because once you remove all these machines and tubes, definitely he will die, because he's on high inotropic support, which is very sensitive. Whenever you stopped it, he might die within minutes or maybe seconds. Okay, because this is the medication effect. Let's go to the other concern. Will my mom come to see him before you disconnect the machine? Yes, you can respect this and appreciate her concern, her worry, and we can wait until your mother will come. uh, if she can come soon, please let her come to see your father, because he might even die on this support, right? Because you know
Mm,
the multi-organ failure, and anytime, even with support, he might have cardiac arrest and he might die. This is for the second concern. I think support you offered, right? You offer support, but again, rather than giving the summary, or rather than summarize the case or what happened in the scenario, please offer support more and more, because she already heard the bad news. Now you are again reminding her what happened in between during the discussion. So it's not a good idea to repeat what have been discussed earlier, which were all painful for her, right? So the best way is to offer support. As I mentioned the previous session, the bereavement team is very important in this scenario to offer. They can sit with the mother as well as the daughter to support her emotionally and socially. And you can add also another question for support. Who is dependent else on your father? You can call him to come. We have our professional team. They can sit with you. They can support you, and so on. The other point also, the concern is advanced directive. You covered it well. Any living wish, yes, he want to die or he doesn't want to be under heart massage, it will be going with the medical decision. You can say, yes, I appreciate your concern and your worry, and we can do what your father wished, and we can let him die in peace as he wished earlier. We respect his wishes. Okay?
Okay.
Then the closure of the meeting. Yes, as you said, you have our contact number, the hospital, anytime you need support. This also a brochure website about the withdrawal of treatment or palliative care, or sorry, in this scenario was end of life care, or in any scenario. According to the scenario, you can offer the brochures about the topic itself. Okay. Again, the task will be written clearly in the exam. Don't worry about that. You know what the problem in the exam? The control of your stress. You might write everything in the paper, prepare yourself. Once you get in and you face the angry surrogate or sad surrogate, emotionally talking surrogate, angry surrogate, any of these, you will forget everything. Even introduction by yourself, you might forget. That's why you are
Yes.
training here what to do and how to control your stress whenever you face this. It will, or she will try to distract you, to disturb you. Whenever you talk, she can stop you, and you have to listen to her. If you interrupt her, it will be against you, and so on. So we know how to do and what to do, but the stress of exam will make your brain distracted away from the scenario, away from the scheme you wrote, away even from the introduction. You might forget to tell, I am Dr. X, I am here to discuss. You might say, what's your concern? So how to control your stress? This is the point, how to pass the paces. Okay? Any
Okay.
question from your side?
Uh, so not to summarize, right?
Yes. An angry
In angry
person,
uh,
or yes, sad news
or
or breaking
sadness.
bad news,
Okay.
or yes, or what one more. So yes, a medical error. These three things, don't repeat or don't summarize or don't recap. Okay. The procedure, counseling, medication. Okay. Counseling about disease. Okay. They mentioned capacity in the scenario. Task is to detect that capacity. Yes, you can. Please, you have to ask in the capacity. You have to ask about. Sorry. Yeah. In the capacity scenario or the task, if the task is to check or to detect the capacity, the recap or the summarization is very important. It might be your mark to pass this station. You have to ask him, please, can you summarize what we have been discussed together today? Yes, I came. If he is having the capacity to do, so he has the capacity. If he lost in between, so you can detect that he is lost, or he lost his capacity, and you will show the examiner that you checked that and confirmed that during the scenario and at the end of scenario. Okay.
Okay.
So medical error, breaking bad news, and angry person. Don't repeat and don't recap.
Okay, Dr. Basim, I want to ask you about
Yes.
away from this scenario.
Yes,
We
sure,
have a
sure.
scenario like prostate cancer and
Mm-hmm.
with metastasis to the back, and I'm talking
Mm-hmm.
to the patient himself about palliative, for example, or something like this. Should
Yes.
I talk about DNR also?
If not written DNR, don't talk about it.
No, no, no. I mean advanced directive. I'm sorry. Advanced directive.
Okay. If first time, this is first time to talk to the patient. I mean, this is just discovered.
He knows about his prostate cancer, but he doesn't know about the metastasis.
So
And
he knows about before, right? There was a meeting before, and he knows about the cancer, and so he can be ready to know, or to ask him about this question, because this question
Mm,
also is shocking question when you ask someone just diagnosed today for cancer, and you ask him, what's your advanced day, or what you want in your life. He just started the trip, or the sorry, the journey of suffering, and you just give him this question, like you will die after we discover. So it will be like double shock. So it's not advisable to, for the first meeting after discovering a disease, to ask about advanced directive. If he was diagnosed before, and he came to you now, to check for spreading cancer, yes, you can. But if from first meeting, I don't prefer that. You got it?
For myself, I can answer that I can put it in the file, write it down in the file
Uh-huh.
to have a document to in case of you are cannot have decisions, we can decide upon your living
This
will.
is this is lasting power of attorney. Eh,
Okay, no, I mean his advanced directive just to have a
Okay,
copy.
document about if something to do, not someone.
I mean, if he has a living will,
Okay.
we can document his wills in the file or something in his file.
Okay, you
We'll have
can,
a
yeah,
copy
you
from
can,
it.
yeah, you
This is
can do it.
my
Yeah, you can do it in this way. Yes, yes. If you
okay.
lost your capacity, if you are not aware, and by the way, you can also in these scenarios ask about lasting power of attorney.
Yes.
Yeah, because yes, in this journey of disease and complication, he might not have the capacity to decide for certain decisions, procedure. So it's the best thing is to ask him if he has someone nominated for his decision or on behalf of his decision to take the decision on behalf of him like this. By the way,
Okay.
something from mentor to mentor. Some of them saying that, and it's not a major mistake if you ask, but avoid to make it in the first meeting or the breaking bad news in the same session or same time. I don't prefer it. But if you have the way how to start it and to ask it, it's up to you. But I don't prefer. For me, I will do it if he has already diagnosed before with, for example, motor neuron disease and he's suffering a lot. So I can expect he will be deteriorated more and more. So I can ask this question. A cancer just now in the early stage. So and I don't prefer to tell him or to ask about these things. But if from the first time his cancer is advanced and it's spreading everywhere and already the prognosis will be poor, yeah, you can touch this point, but not in details. It depends actually from scenario to scenario and from person to person and from examiner to examiner. You might say this with examiner, he will comment, and the other one will make it satisfactory. But no
Mm.
rule, no clear or rule. The advanced directive, you should do it whenever you have palliative decision or like this scenario, end of life care, or patient already lost capacity in coma, and you can ask the son about his father advanced directive. Progressive disease like motor neuron disease and advanced complication happen also aspiration and so on, COPD, ventilator failure, sorry, respiratory
Mm.
failure. All these scenarios. So already the patient known to have a lot of suffer before. But from the first meeting after diagnosing the patient, I don't prefer to start or to ask about advanced directive. You got it.
Okay, but we are going on the same way. You told me that if we have going to discuss palliative, so such patient I talk about prostate with metastasis. I'm going already to discuss the palliative care for him. And already in the beginning, in the Breaking Bad, I told him that his potentially life-threatening complication from his cancer. And I'm going to say to him that the palliative is not targeting the cancer. We are going to make you pain-free and enhance your quality of life. So why not to ask about advanced directive? I think it's okay. I think that
Yeah. Yes,
I'm
but
sorry,
you said
not from the first visit.
yeah. This is
Not
no,
from the
also
it's
first
only one
visit with the
visit.
patient still
You are in
digesting
exam.
I'm sorry?
It's only one visit.
uh,
You are in exam. You are required
Yes, but it's
no
the
no.
first
observing
visit that
your.
you are explaining to the
Let's
patient about the diagnosis
yes.
I
for the
This is
first
my
understand.
time,
point.
Okay.
or this is like a second or third or fourth visit in
Let
the
me
scenario.
confirm, Dr. Karim, you are the oncologist, right? I remember
Yes,
that. Okay, good.
yeah,
Give him the sure answer because I am also with you, the same point. But still, if he's doubtful about this, please confirm it.
Yeah, I'm sure. Not from the first visit. Imagine you are, I'm sorry, like imagine you are the patient, and I'm telling you and this is like our first visit, okay? And I'm telling you, you have like a prostate cancer, and it's metastatic or spread it to the bone, and I will give you like a palliative radiotherapy, and the aim of treatment is not cure. Like I'm giving you a lot of bad news. So, and on addition of all of this, telling you like if you think about end of life care, and who will be like take the decision if
Taking decision,
to
yes.
remove support or something like that, all in the first visit, I think will be too much. So like in real life, we're not doing that. In the first visit, we are explaining the diagnosis to the patient. If he asked about the prognosis, I'm telling him. If he didn't ask, I'm not telling. I'm just telling
Yes.
him and be sure he understands that the aim of treatment is just to control and is not to secure, and it is not a curative treatment. That's it.
Yes.
If he
Okay, can I
asked
ask you a
about
question?
like prognosis, about how much I I will live, I will try to tell him, but in a sensitive way. That's it. But like not in the first visit, I will tell him about the diagnosis and the treatment and the prognosis and the end of life care. Too much for the patient from the first visit.
Okay, Dr. Karim, Dr. Bassem, did you practice the old exam when the communication was 4 minutes
No,
or five
no.
minutes with the examiner?
Yes. No, I
Did you
didn't, but I
practice
know
that?
that it
Okay,
was
I will tell
60
you
minutes.
something.
Yeah, it was 60
Okay.
minutes. So a lot of things you can do in 60 minutes. But now you are talking
No, no, no,
about 10
no. This is
minutes.
not my point. This is not my
Uh-huh.
point.
Okay.
Just wait. The examiner will ask you before the old station. The examiner will ask you what are the ethical issues, what are the legal issues in the scenario. You will tell
Yeah.
him, blah blah, and the advanced directive, of course, you will tell him. Now he is not asking you, so he is
That's good. Yeah.
expecting you to show this. Like when you say consent, you have to say to the patient the criteria of the consent, because he will not, the examiner will not ask you, but he should feel that with your with your explanation to the surrogate. You
Dr.
get my point?
Dr. Ahmed, by the way, we are in the same track. Dr.
Okay.
Karim and me saying the same opinion, and I
Exactly.
think you are
Exactly.
also.
Uh,
In
sorry,
the first visit,
Dr.
you
Basim, if you allow to me,
yes.
me with the doctor who took the last things, because
Mm.
nowadays no questions, and guys
Yes.
who didn't ask about advanced directive and LBA in the scenario of breaking bad news, even in the first visit in the exam, they deduct plenty of mark from them. That is why there is difference between real life and the exam. That they want to test us how they know the
الله
legal
يفتح عليك.
ethics.
Okay, doctor, you have the scenario, or you are talking about same scenario or maybe different scenario? Because me and Dr. Karim saying it's counseling about cancer, just now discovered in the CT, and you have to explain to the patient how can I explain a disease and cancer, and in the same time I will tell him what do you think? What you want before you will die? Because I just now give him this news. This is my opinion also. I don't know.
I
This
Exactly.
think
scenario
Dr.
you are talking
I
Dr.
about.
Karim
think
Yes.
raised one issue that in sensitive way, in indirect way, if you have know this, I wish you to do like that. Just we can play with words. That examiner can know know this.
I think it depends on the scenario. Like if
Yes.
the scenario is
okay.
I agree for
asking
this.
to talk about the end of life or the yeah, we will go through all of this. But if he is asking about like explaining to the patient like the procedure about PRCP or palliative radiotherapy or like that, I think I will be just be in this area. No need to go further beyond to the or to jump to the end of life. I think it all depends on the
No,
scenario.
no, Dr. Karim, the end of life is not the question for Dr. Ahmed. He's asking about the advanced directive, not end of life.
Ah, okay.
Okay, he's asking when to ask these things, advanced directive. will he explain or ask about advanced directive whenever he has scenario for example, for cancer prostate? Will he explain the or ask about advanced directive in the first or in the meeting, in the same meeting when he explained the cancer
Mm.
prostate? Maybe you
And
misunderstood.
With metastasis.
Yeah, with metastasis, okay, I can speak about. But first time, just early stage, maybe he still will live long. Maybe he will respond to chemotherapy. So why I ask him about advanced directive. So it will depend on the scenario, and it will depend on the examiner. So I guess so.
Okay.
You got it, all of you, Dr. Ahmed and Dr. Karim.
yes, yeah.
So end of life care, yes, of course you have to ask about advanced directive. But let's imagine a scenario for cancer. Let's say Hodgkin lymphoma, okay? Hodgkin lymphoma, one of the good or the best prognosis cancer, right? So, and
Exactly.
will I ask the patient advanced directive when he is diagnosed with Hodgkin lymphoma? So it depends on the scenario, right?
No,
Exactly. Yes. So when you will
because
ask
it's curable.
whenever you feel his prognosis is not good, right? Or that the
Okay,
disease
but
will be progressive.
hmm. anyways,
Like,
as I mentioned, Dr. Basim, it's
uh-huh.
a play. It's a game. You
Yes,
can
it's a game. Yes.
how to play with them. I think that
Yes, of course, it's a game and show.
Mm.
And also for the doctor said about the examiner deduct the mark because you didn't touch these point. I agree, but in certain scenario, I think that you are talking about different scenario that we are talking about. If you can give us the scenario you practice or you experienced or your friend experienced and they deducted their mark, please let us know what was the scenario because we will get benefit also from this.
Okay.
Doctor, if you can hear me.
Okay, Dr. Basim.
Yeah, but I am asking. I don't know her name. Also, her account was Zoom user. She said you should talk about advanced directive. So I want to know what was the scenario she's talking about. Doctora, if you can hear us, please.
For me, the patient is in the stage of life, like metastasis with with palliative
Okay,
treatment.
for your scenario,
I should
yeah,
go
you
through
should.
the
Yes, of
ask
course.
about it. Yes.
Yes, cancer prostate spread means prognosis will be poor.
Mm. Yes.
But for example, let's say another cancer like just discover now and we don't know even the stages.
Yes.
Maybe
Yes. Yes.
just yeah, I think this time you don't have to talk about advanced directive. You didn't even diagnose the staging. You might have primary cancer controlled only within one side or whatever the lesion where. So still you didn't diagnose. So no need to ask. This is my point. So it will depend definitely upon the scenario and the situation you are talking about. Okay?
Okay.
Give me my scenario until
I
we can.
wanted.
Uh, as you like. If you don't have, no problem for me.
I will have, but I'll write it in the chat box or what?
Okay, right. Anywhere in the chat box in the WhatsApp group, you can
Okay.
make screenshot of the scenario if you have written. If you have written scenario anywhere, make screenshot and send it.
I have a lot of scenarios, but I want to discuss this scenario. It's
No
about
problem.
TB.
That's good,
Okay.
good and great. Yes. Whenever you
Okay.
feel
I will write.
yourself
Mm.
weakness point in certain scenario, share it and do it. You will never forget it.
Inshallah.
Thank you, Dr. Karim, for your comment. And I forgot to ask Doctor about her name. Anyway, all this discussion will be beneficial for all of us. Even the discussion itself will make the things more clear. So please, whenever you have any inquiry, any debate, share it with us and we can clarify the issues. Dr. Azhar, are you here today?
Yes. Assalamu
Yeah.
alaikum.
Alaikum assalam. Let's hear
How
your comment, please. Yeah, I'm fine.
uh, I don't want to make any comment, mashallah. Everyone has made very good comments. I just want to ask
Mhm.
something, as you told, that if there is any patient of angry patient breaking bad news and
Uh-huh.
mistake scenario,
Yes.
we should not summarize the case.
Yes,
If
exactly.
a candidate or a patient should not summarize the case.
Yeah, again, the last sentence I didn't hear.
Uh, uh, as you told that in
Yes.
for these three scenarios
Yeah.
should not be summarized.
Mhm.
Who will not? Candidate or surrogate?
Okay. As I said also earlier, one scenario you have to make the surrogate recap for you, which is capacity. Any capacity scenario. Sometimes they are bringing scenario to check. You have to check the capacity for the patient. In this scenario, you are the one must ask the patient, what did you get from our meeting today? Okay. In other scenarios, you can summarize, but better also to let him summarize. For example, the procedure, you can say, we have discussed today the procedure and blah, blah, blah. But also better to ask him, please, can you please repeat what we have been discussed today, what you understood from our meeting today? And he will tell you, because this is also another decision for procedure. He has to know everything about the procedure and the steps and the side effects and the consent and so on. So any scenario you can let him recap. And the most important scenario to recap is the capacity scenario. Whenever you have patient to check his capacity, after you finish discussion, please can you repeat for me what we discussed today and let me know what you get from our meeting. This is the way. Okay,
Okay.
clear?
Yes, yes. Regarding
But
this scenario, as
yes,
we were discussing that advanced directive and living wish, I think because that in first visit, I think we should not discuss these things.
yes, agree. Yeah, this is
I
what you
want
said. Yes,
in
and
second and third visit.
exactly. And how you get this is first visit from the scenario? How you guess that?
Yes, yes, yes. Because if the first visit, we are just only communicating or breaking the information, and we do
Exactly.
not
Yes.
know the
Yeah.
prognosis of this disease.
Yeah. And
So,
they will write for you. Yeah. Explain the result of CT or the result of finding biopsy, SNP. It will be like this. But for the previously diagnosed patient, you will have known patients. For example, they will tell you this patient known to have cancer, for example, cancer prostate, and he came today to discover with him or to discuss with him newly discovered spread or metastasis to certain area. So both scenarios are different, right?
you are
Yeah. Okay. Thank you, Dr. Azhar, for your comments.
welcome, welcome.
Yes, we have Mr. Jack, 35 years, complaining of fever, productive cough, loss of weight for the last 6 weeks. Chest X-ray, acid fast bacilli, and TB PCR revealed diagnosis of TB. You are senior house officer of medical department on call today. You have been asked to discuss the result with Mr. Jack. Okay, can you give me 1 minute? Then we can start. Okay, let's start.
Okay.
Ready?
Yes.
Okay, here we go. Hello there. I'm Dr. Mukhtar, the doctor in the unit today. You must be Mr. Jack.
Yes, doctor.
You are 35 years.
Yes.
We are here to discuss about your health issue. Is that okay for you?
Yes, doctor.
Okay. Be sure also this meeting is confidential, and feel free to ask me anytime you have any concern.
Thank you.
Can I ask you what do you know so far about your condition?
I have been admitted, doctor, for the last 3 days or more, and I have chest infection, as you mentioned to me, as the team mentioned to me, and I have been given some medications, and you have make some investigations, and I want to know if I have serious condition or not.
Yeah, I appreciate your worry and your knowledge about your condition, Mr. Jack. Can I ask you what do you have any idea about what's ongoing?
No, doctor, I'm not sure about. I think it's bug infection, and I will be admitted for some days more, and I will be discharged, improving.
Yeah, I appreciate your worry and your concern, Mr. Jack. Uh, really, I have collected the result for you, and I have some concerning news.
Okay, doctor, what's that, doctor?
Yeah, actually, the result came as we don't hope. Is not good as we hope. I mean,
Okay, doctor, do I have cancer, doctor?
I appreciate your worry and your concern, Mr. Jack. Actually, it's not a cancer. If you give me a chance, I can explain to you what you have exactly.
Okay, doctor, what do I have, doctor?
Yeah, so after the blood test and the scans of your body and your blood, we discovered that you have a condition called tuberculosis.
Okay,
Have you ever heard about that?
I heard about it, doctor, but can you tell me what is this, doctor?
Yeah, I'm going to explain everything. And again, if you feel any inquiry, please stop me and ask me to clarify.
Okay,
Okay, so tuberculosis is a condition in which there is superbug called Mycobacterium. Don't bother about the name and the name of the disease. We abbreviate it as TB. Okay, let's say and let's talk about it as I said in the abbreviation TB. So the TB, one of the super bug infection catching the lungs and sometimes outside the lung going to other areas in the body. However,
okay,
what you have now, it's in the lungs. Do you follow me?
yes,
Okay. So the sequelae of this condition, sometimes it might cause the cough and the blood out with the cough, and sometimes you feel loss of appetite, some weight loss, as well as high grade fever or high body temperature, and sometimes you suffered from night sweats. All this happen whenever you don't take a medication. Do you follow me?
okay, doctor, is that serious, doctor?
Yes. If you give me a chance, I will let you know about the complication of the condition. So the TB, if not treated, it will be very serious. It might lead to some scarring in your lungs, up to breathing difficulty, might create your life. And in some condition, you might be connected to breathing machine. I'm so sorry to say that. Do
Oh
you
my
follow
God.
me?
Yes, doctor.
Yes. The good thing if you let me complete, the good thing, whenever you take your medication on time, you will live near normal life.
Okay.
So, do you have any inquiry so far about this condition? Any
Okay.
question?
Thank you for assuring me, doctor. Okay, what is the medication? What's the treatment? Okay.
Yeah. So, uh, in the end of this meeting, we gonna collect some of expert doctor. They will sit with you and they will let you know more about the medication, along with the chest doctor, the pharmacist, and specialized nurse. And also, we have to inform what's called infection control team. They are the team concerned for such condition and such diseases. Do you
Okay.
follow me?
Yes.
Yes. Okay. Before starting the medication, we have to do something very important. We have to admit you for about 2 weeks to be in a side room.
Okay.
Are you following me?
Yes, doctor. But this, I will be alone in a side room.
Um, I appreciate your concern and your worry, and I'm afraid to say yes, you might be in the room alone in order to prevent spread of this infection to others. And there will be at a window you can watch the nature around, and you can see the other people outside. And we can also provide you with some social and virtual instrument inside the room in order not to feel alone. How do you feel about that?
No, doctor, I can do it at home, doctor. I can isolate myself in a room at home, but in
Oh,
hospital, never, doctor.
may I know why, Mr. Jack?
I will feel bored, doctor. I will go at home, to feel relaxed, to feel safe, to feel everything at home
Okay,
better for me. I can do it at home, doctor.
okay,
Especially, I am good. I can walk, I can move.
okay, Mr. Jack. Let me ask you. We can provide you this in one occasion only. If you have good room with good ventilation and with isolated and separate washroom or bathroom, no one will share this room with you. Yeah, in this occasion only we can accept. And the sun should be also, your room should be exposed to the sun in daily basis.
Okay, doctor, thank you for
It,
all of this, doctor. But please, doctor, if you can do it for home, doctor, at home, I can do that at home. If you
yes.
can arrange that for me, please, doctor.
Okay, I appreciate your concern. We can check your room first, and if you have this things in your rooms, we will accept it.
2 minutes
But we
left.
have to
Okay.
check.
Okay,
Okay,
doctor.
can I know who's living with you, Mr. Jack?
I'm living with my wife, doctor.
Okay, so you don't have kids.
No, doctor.
Okay, uh, let me tell you that if your wife can stay away from you and she can't eat with you, she should stay away from you, even with eating. And whenever she have near contact with you, she will wear mask and to be about 1 meter distance between you and her. If you can provide all these things, we can check the availability for that. Is that okay?
Okay, doctor. Okay, doctor. We can do it.
Okay. Okay. May I know what's your job?
I am accountant, doctor.
Okay. We can provide you also sick leave to be away from others. And can I ask you if you smoke
Yes, doctor.
and you drink alcohol?
No.
Okay. Let me tell you advice about smoking is very harmful for your condition, especially with this condition. So I strongly recommend to stop smoking. And if you need some help, we can refer you to smoke cessation clinic.
Okay, doctor. I'll think about that.
Any other concern?
No, doctor. Thank you.
Okay, we will arrange another meeting to uh, describe for you how to take the medication and when, and the compliance and the importance of compliance and adherence to the medication, along with some instruction about the disease and advices, leaflet and website, and brochures about the medication and about the TB itself. You have any other concern?
No, doctor, thank you. Time's up.
Okay.
Uh,
Okay, you
I
can
think it's
comment now.
too, it's very big case for the 10 minutes. I think that, but you did it well. I think you
Yes.
covered everything, but maybe some points. I don't know. You will have time to do that or not. I think you should draw something. Just draw a lung and put something in the upper lung, something like this. It will mark more. What do you think about that?
I think even with the drawing, the time will be more difficult to control and
Yes,
to
yes,
manage
yes.
them.
Okay.
Either to draw or to explain. I don't know. It's
Yes.
difficult scenario, yes, and it will not come in all this information and the task. It will be targeted to something, either
Yes, yes.
medication or
th-
counseling.
mm.
Yes,
It's about isolation issue and the medication
exactly.
also that you
Yes,
didn't have time to discuss the medication. You are not required to mention the medication, of course. Just
yes,
you will
exactly.
have four medication in the first 2 months. Then this medication has some side effects. We will follow up the liver function, the nerves. يعني just in
Yes.
general, just in 1 minute like this.
Mhm.
About
Yes.
also, I think also when you said I'm sorry, you have some empathy, but not full empathy. You should when you say you will have life-threatening like destruction of the lung.
Yes.
Before you answer, I asked you, is that serious? You said you should say first, I'm sorry, before you start. You directly said yes, it is serious and may blah blah. You may will be put on the ventilator. Then sorry at the last. You
Mhm.
understand my point?
Yes, yes, yes.
Better at first. I'm sorry to tell you that it's yes, it's serious like this. Starting by sorry first.
Okay.
Another issue about okay about screening also. The people
Yeah,
that around you, we are
tracing.
going
Yes.
to call them
Yes.
for some screening,
Yes.
just like this.
Contact tracing. Yes. I planned it, but actually I don't have time to do.
It's
No
very
problem.
long.
Yes.
It's very
We
long
are
case.
learning.
Yes. Hmm.
Yeah. I think this is the only issue I wrote, but I didn't do.
But you
Infection
handle the
control
isolation
and
issue very well.
yes.
You
Yeah.
handle the isolation
So
issue very well, and you will you offer to check the room at home first. Yes, this is very good. Yes.
yeah. Actually, most of the scenarios of TB will be for the isolation. And
And
in some scenarios, they will accept, and the others, they will not accept.
also meningitis, I think.
Yes, the meningitis as well. But
Mm.
meningitis should be at hospital, never at home. Isolation at
Yes,
hospital. The
yes.
TB can be only in one situation, which is he's not in crowded area, no kids with him, no one with him immunocompromised, no elderly patient with him or elderly family members. In the same situation you did, he and his wife, that's it. So his wife can stay away, just give him the food from outside. He has separate bathroom, good ventilation with the exposure to the sun. All these things can help to be accepted isolation at home. Yes.
Yes, and good thing that
Any
you
other
told him
comments?
for 2 weeks or also, yeah, until the
Yes.
sputum become clear or something like this.
Yeah, should
Because it's
specify the
infectious.
duration.
Yes, yes, it's infectious for the first 2 weeks or until the clinical symptoms gone.
Exactly. Yes. Any other comment?
I have to comment, Dr. Basim, you did it very well, explore everything. When he asked you the concern that I will be alone, you mentioned to him you might be alone. Definitely he will be alone, not might be. Okay.
Okay.
I will be happy to be alone.
Or you want him to be more depressed?
No, but you mentioned that you reassure him by the window, the glass window, you see the world behind that. Okay.
Yeah.
By
Yeah.
the way, if I am the patient, I will prefer the hospital.
Another thing,
Yes.
when you have I have serious concern to you, and you have keep eye contact to the patient. The patient,
Uh-huh.
before how much you know about your condition so far, simple infection will be resolved and something like that.
Mhm. Yeah.
Maybe you prepare yourself for more worse, that to approximate the distance between you and the patient and the surrogate. But the surrogate, when you mention to him that I have serious concern to you, the surrogate volunteer that, is it cancer? When he mentioned to you, is it cancer? Don't let him breathe down and relax. Directly shoot the news, the bad news, because now he is ready. It is not a
Yes,
cancer, but
yes, yes,
something
yes.
also serious, because don't let him breathe and prepare yourself for another shot and for another approximation. Maybe he will feel relaxed when we mention to you, it is not a cancer, but let me explain to you. Maybe he will say, thank you, God, it is not a cancer, I relieve. And in the chair, he put his head like that, and you are on another way to prepare him again for
Yes.
the bad news.
To another
What do you
shot.
guess?
Yes.
Okay.
It's
Yes.
precious information for me. Thank you, doctor. Thank you.
Thank you. Thank you.
Really. Yes, because already he told you it's a cancer, so you can give him the bad news directly. He will accept. He will
Yes.
accept this news
Yeah.
because he already was anxious for the cancer, the top
Yeah.
thing.
Yeah.
Yes, yes.
Exactly. Apart from that, he did it
Yeah.
very well. Yeah.
Thank you, doctor. Thank you.
Dr. Bassam,
Yeah,
can
but
I add comment?
sure.
Dr. Bassam, I am here in Saudi Arabia. I am a part of the mobile team. I have two comments. Number one, you did very well. But when we are admitting the patient in hospital, we cannot say that there will be a window will be open. You can have a view outside, because in hospitals there should be negative pressure room. And without negative pressure room, patient should not be admitted in the hospital. It should be negative. Why? Because if the germs are going outside, it is spreading in all the hospital.
Exactly. Yes.
So it is both droplet and airborne infection. When a patient of TB, he breathes once in the room, the organism remains suspended in that room from 3 days up to 3 months. So
Mhm.
if the patient in hospital, he should be in the negative pressure room. In the home, you can say there should be good ventilation. We will go there and we will see there everything. If it is okay, sunlight is coming, it is okay for you. One
Yes.
second point. Second point, for every communicable diseases, remember the word RINS, RINS. R mean reassurance. As you did, you reassure the patient that the good thing is if you will start taking the medication, you will have a near normal life. And then I mean we will isolate you. And then N notification. Since it is a
Notification.
communicable disease, it will be notified to the higher authorities. S
Mhm.
means screening of the people which are living or working around you. It is all for
Yes.
communicable disease like meningitis and TB and
Yes.
some other communicable disease like mumps, rubella,
Yes.
chicken pox. So in the exam, we can use RINS in this way. We cannot forget the format.
Okay. Thank you. Nice mnemonic, Dr. Azhar. Thank you for the comment. Yes, you're right. I put some I put a room from my imagination, windows, trees, and TV, just
Actually,
to to
at hospital, it is not
attract
like
you.
that. As Dr. Azhar said, it's a negative
Yeah,
pressure
I
room.
just.
There is no window.
Okay, what's your task here in the exam to convince the patient? My task is to convince whenever and wherever the room is. This is not my job. They can arrange this room or not. This is not my task. My task to convince. And they will admit whenever they want or wherever they want. Okay, joking. Yes, you're right. In real practice and real life, no room like this. But I guess there is also some VIP hospitals. They have this availability to do such advantage. They can put a room with good views or whatever. I know one hospital in Jeddah, I think IMC, they have very good environment around with views, and it's for VIP, of course. That's why I can imagine this hospital during the discussion. Apart from this, the other hospitals, as a rule, they don't have this advantage, of course. Yeah, I agree with
The
you, Dr. Azar.
the problem, not this advantage, Dr. Basim. The problem that the TB, as Dr. Azhar said, it's airborne infection. So
Yes,
it
they can
should
do.
be closed room
Yeah,
with the
I
negative
mean the
pressure.
window, not. No,
Mm.
no, he can't go outside the room. I mean the room
Mm.
itself will be closed, but there is windows, glass windows, not opened one.
Ah, yes, yes, yes,
Glass,
yes, yes. Okay.
yeah, with
Uh,
glass
uh,
only, just glass.
uh, and the glass window is okay. Because in
Yes, yes,
our hospital, there is no negative pressure room. When we have any case, we are sending to other hospital.
Okay.
yes.
Yes, you're right. Of course,
And
a negative pressure room in our hospitals, like prison, it's closed from everywhere, and no one can see you from inside unless even you have two doors to go inside. It's like really like a jail. So
Yes,
I think my imagination was very far away from the reality.
yes. But Alhamdulillah, you did very well, and
Thank
this
you.
scenario is very, very big.
Yes,
It's very
yes.
difficult to cover in 10 minutes.
Yeah,
First,
you're right.
my most important thing is when you have any case, please try to cover RINS, RINS, reassure, isolate,
Alliance,
notification, and
Prince.
screening.
Yes, you're right.
yes, and the notification, I think better to say directly to the higher health authorities, not infection control. Of course, infection control knows about the case in the hospital. So
Yes,
directly
yes,
show the examiner that it's a notifiable disease to the higher health authority.
Yes,
yes,
you're
yes, 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 yes. You are right.
Okay, thank you.
yeah. There is one missed point here in this scenario, but it's not for our scenario. In another scenario or TB scenario with non-compliant to the medication, which is called DOT, direct observed therapy. This is one of the solution. If the patient is not compliant to the medication, you can help the patient compliance, or you can uh, be sure about, or you can be sure about the medication intake by this team, direct observed therapy team.
Yes,
They
yes. We
can
are
go
going.
to the
We are
patient.
visiting the home. We
Yeah,
are visiting home
exactly.
every week,
Yes.
and then we are checking his mouth before and after the medicine. Sometimes they are keeping the medicine below the tongue, and when we move out, they will throw. We will say we want to check your mouth all around, and we will wear N95 mask, not the surgical mask.
Yeah, of course. Yes. Yes. So you are even checking after, right? Be
Yes,
sure
yes,
that
yes.
he swallowed already.
It's a DOTS program.
Oh, best of luck. Thank
By the
you
way,
for your effort.
it cannot be transmitted through contact. So you can touch the patient. So 1 meter is, I think it's okay. You
Yeah.
can touch the patient, but you have to wear N95, as Dr. Azhar said. Yes.
Yes.
Yes,
Yes.
N9.
Exactly. Okay. Good point
Droplet
and good
only.
discussion. Yes.
Droplet only
Sure.
like meningitis to be away 1 meter at least, I think.
Yeah. It will. Yes. It will fall
Yes,
down
like
to the
COVID
ground.
also.
The criteria of high risk and low risk is that if the distance is more than 1.5 meter and the duration of stay is less than 10 minutes, it is less risk. But if the high risk is if the duration is less than 1.5 meter and the duration of stay is more than 10 minutes, it is a high risk exposure.
This is the infection control updates from
Yes.
Ministry of Health, I think. Yes.
Yes.
Okay.
Okay. Thank you, Dr. Azhar and Dr. Ahmed, for the nice discussion. Any other point anyone want to add comments? Feel free to comment and to share. Isolation. I for isolation, yes. So rinse are for
Reassurance.
reassurance, yes. Reassurance, isolation,
I-
and notification, rinse, and screening.
S,
Yes, right.
S means screen. Like if you have any case
Yep.
of measles, mumps, and then
Encephalitis or
meningitis,
meningitis, yes.
you can use this mnemonic rinse.
Nice one. Thank you, Dr. Azhar. Any other comment from others, please? TB, like it's somehow difficult to practice it because we are not familiar with such diseases. So if you have any question, please, you can ask and you can share it. Yeah, as Dr. Ahmed said, also TB as anti-TB medication, they might be as a counseling. Don't be worried and don't be panic. What the medication, what I can do, just try to remember the regime 4-2-2-4 for medication for 2 months, then 2 medication for 4 months, in total 6 months. And as we know, the first line INH, isoniazid, pyrazamide, and ethambutol, and don't forget to add the pyridoxine, vitamin B6. Just write roam around this medication, rifampicin as well. And the side effects, you can say GI upset, taking by oral, and you have to be compliant to the medication. Please don't drink alcohol because of some interaction along with the smoking for interaction as well as for the lung itself. And you will feel the time will just goes. Don't be panic and stop what I say, what I discuss. It's like that. The frequency, the duration, and the route for any medication: frequency, duration, and the route. If you cover these three things, I think you can finish 5 minutes explaining the route, taking orally, and you can say, please, if you can take it on empty stomach, or the opposite, if you have a medication to be avoided in empty stomach, you have to take after meal, and upright in some medication like bisphosphonates. Some of these precaution and instruction, it's very important, and you can utilize the time with. Then the duration for how long the patient will take the medication, and the route duration, frequency, how many time per day, 1, 2, or twice a day, or once a day, or every 8 hours, whatever the medication, or once weekly. Then the complication or side effect, what the side effect might be from this medication. Any medication, you can say GI upset. You might feel sick, you might throw up, some reaction, some dizzy. Any medication, you can say this medication, and to give him like warning, please, whenever you take the medication for first time, take it while resting. Don't take it while doing exercise or going outside or whatever, especially the like chemotherapy medication. Then specific side effect for each medication. For example, rifampicin, red urine, red tears, red red saliva, or any secretion from the body. This is for rifampicin. Don't worry whenever you see your for this, the waterwork being brown or red. This is the medication side effect. For INH, the peripheral neuropathy. That's why we are prescribing vitamin B6. For ethambutol, any change of the vision or action or any blaring, please let us know or visit the emergency immediately. So what's remaining? Ethambutol, rifampicin, INH. What else?
Streptomycin.
What's the fourth? Sorry?
Streptomycin.
Streptomycin. Yeah, I'm not familiar with streptomycin. I think this is the most common side effect.
Yes, yes.
Yeah, and you have to be compliant to this medication to live near normal life. If you are not compliant or you missed any dose, it might make the bug more infectious and more potent and more strong than you have. It might be a super bug, and you will be in trouble in the future. The medication will be more stronger as well, and the side effect will be more side effect, and the scarring of the lung become more liable for your condition. So please be compliant to the medication. And at the last 3 minutes, you can ask for concern. You can ask about the support, who's living with you, do you need any support, your job, and smoking and alcohol, and so and that's it. It's a matter of how to arrange the talk and go through it. Put scheme and follow the scheme. Don't be panic, okay? This is the aim of the discussion, I mean. Any question or any comment from others regarding TB or the previous scenario, end of life care? Pyrazinamide, yes, pyrazinamide, yes, pyrazinamide. Streptomycin, I think from the second line, Dr. Azhar. Pyrazinamide for the
Yes,
first
second
line.
line. Second line.
Yeah,
Second line.
pyrazinamide, I also I don't know the side effects exactly. If someone
Gout.
knows
Gout.
pyrazinamide.
Gout.
Yes, gout.
Gout.
Yes. You're right.
Gout.
Gout. Yes. Yeah, calcium, high calcium, and yes, high uric acid. Okay. Also, you can say about some stones or renal stones. Anyway, take it like this: general side effects and specific side effect, and some interaction with medication or some interaction with alcohol or smoking. So please, and also you can invite dietitian for any medication, new medication. We can call the dietitian to sit with you and tell you what the appropriate diet or the good diet you can take in order not to be having any interaction. Like warfarin, for example. Warfarin is very important to mention the dietitian for the food interaction to the medication, to the warfarin, I mean. That's it. Okay, sorry for being... Yeah, liver function test and gout. Okay, thank you. We talk lengthy today. Yes.
About the first scenario, as the surrogate was asking that my mother, she will arrive, please don't remove the tubes. So we will
Yes,
wait
this is
for the
good
mother.
point. Yes, you can if she is near. For example, if the trip will be, for example, today, not more than today. Yes, you can wait for her. But if she said no, no, she can come after 1 week. So you will leave him 1 week. So the decision will be changed now. What the benefit of our decision? Decision for end of life care means maximum hours. So it's difficult to keep her or to keep the patient on the ventilator and machines for days, waiting for someone to come. Okay, so we'll try our best, but he might die even after the support. You got it.
We can say we can discuss our consultant before answering your query. Can we say like this?
You can. So anything, Dr. Azhar, anything it's not clear for you and you are not sure 100% about it, you can refer it to senior or consultant. Your senior or to your consultant. Any point, any question you are not sure about, you can say. But
It's a safety
what I am
net.
saying to you, this is, yeah. Also, you can say what I said because the decision is for minutes or hours. But if it will take long, so I'm sorry, even with the support, your father might die before your mom will come. However, as you said, you can arrange another meeting with the consultant if he can give you more help for this. But I'm not sure about that because his condition getting worse day after day or even minute after minute.
I think
For
this is good
clinical
answer. I think
judgment,
this is
yeah. For clinical judgment, you can say in diplomatic way, as you said, I can contact my consultant. And you can say also, even with support, he might die because he's not responding anymore. And our decision just to let him die in peace, not to make him suffer. So also as a clinical judgment, yes, he might die even on the support because he's having multi-organ failure. Just we make his suffer longer and longer. So we'll try our best to wait for your mom, but I'm afraid to say it might be unavailable or we might not reach to the time for your mother arrival. So both answer can be right.
Thank you very much.
Thank you to Dr. Azhar. Any other question? Any comment?
No, sir.
If the patient is female, OCPs and pregnancy should be touched with TB medication. Yes, agree 100%. Especially the pregnancy, because it's not wise to have pregnancy while patient is active TB and taking this medication. Any medication, by the way, for the female in childbearing period, better to ask these two questions. Are you planning for pregnancy? Are you taking birth control pills? But for males, it's okay. No need to be, unless for thyroid or radioiodine and some exposure to certain medication which is harmful for the fertility. Chemotherapy as well, but not like common like the females. Any question? Any comments? Any point to be discussed? Okay, seems no more question, no comment. Thank you all of you, Dr. Azhar, Dr. Ahmed, for the cases and the practice, Dr. Karim and Dr. Miru. All of you, I don't want to miss any. See you tomorrow, inshallah. I will end the session. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.